Hello, everyone. Welcome to the Preemie Chats, and thank you so much for joining us here today. I am Thiviya Selvanathan, Executive Director of the Canadian Premature Babies Foundation, or CPBF. We are a charitable organization, and our mission is to empower families of premature babies through support and education. This Preemie Chat series is one of the many initiatives we have to bring information for NICU families and healthcare professionals. Here, every Friday, we talk with experts, researchers, and parents who share with us their knowledge and experience. Also on our website, canadianpreemies.org, parents will find all kinds of resources and support. And today we're going to talk about neonatal seizures. In this presentation, Dr. Selvanathan will review potential causes of seizures and what they might look like in babies. Dr. Thiviya, let me bring her up to our stream here. She's joining us live from Toronto today. Dr. Thiviya Selvanathan is currently a Neonatal Neurology Fellow at SickKids and is completing a PhD in Neonatal Neuroscience at the Institute of Medical Sciences under the supervision of Dr. Stephen Miller. Her research uses advanced brain imaging methods to study the links between brain injury and clinical factors, specifically how we treat pain in babies with brain development in preterm babies. Dr. Selvanathan, thank you so much for joining us here today. I'm so grateful that you accept our invitation to come back and share your amazing work.
Thank you so much for the invitation, and I'm really excited to talk about this very important topic, neonatal seizures or seizures in newborns today. So we'll just move on to the next slide.
Yes, I will just let everybody know that at the end of your presentation, you'll be available to answer questions. So please do send us your questions on the comments. Please share your stories, and we're going to be addressing them at the end of her presentation.
Thank you. So next slide. So today we're going to talk about what seizures are, what are common causes of seizures in preterm newborns, what seizures look like in newborns, and how we treat seizures in newborns. Next slide, please. So we'll start off by reviewing some key definitions. So the first question is, what is a seizure? So seizures are caused by sudden abnormal electrical activity in the brain, and this affects how the brain normally functions. And because the brain controls the body, it leads to changes in the body as well. And when we talk about seizures, we talk about seizures that can be provoked. So these can happen in the context of an acute illness, for example, when our blood sugar is really low, or seizures can also be unprovoked. So this is when there's no kind of illness that's provoking or causing the seizure. Next slide, please. The other important definition for us to know is epilepsy. So when we talk about epilepsy, this is a neurological condition that's characterized by repeated seizures. And we make a diagnosis of epilepsy when a child has 2 or more unprovoked seizures. Next slide, please. So when we talk about seizures in preterm newborns, it's important for us to remember that most of the seizures we see in preterm babies are actually acute provoked seizures. So these are usually seizures that happen in the context of brain injury or an acute illness, such as infection or when your blood glucose is very low. And typically, seizures in preterm newborns do not meet criteria for a diagnosis of epilepsy. Next slide, please. So there are several causes or several reasons why a preterm baby might have seizures. And the most common cause of seizures in preterm newborns is brain injury. For example, when a preterm baby has intraventricular hemorrhage, this could be a potential cause of seizures in preterm babies. Other common causes in preterm babies for seizures are infections. So for example, when they have meningitis or blood infection, sepsis. There might also be changes in the structure of the brain. So there might be brain malformations. And there might also be changes in electrolytes, so things like your sodium or low blood glucose that might cause seizures in preterm babies. It's much less common for us to see that genetic disorders cause seizures in preterm babies, but it's something that we will think about when we don't see any other obvious cause for the seizure. Next slide, please. So what do seizures look like in newborns? So when we talk about seizures in newborns, we divide them into two types. So one is when we're seeing seizures with clinical signs. So we're seeing a change in the body. And with clinical signs, this can involve motor symptoms or motor signs. So for an example of that might be when we see repetitive jerking of an arm or a leg, or we might see sudden quick jerks in an arm or sometimes the whole body. But sometimes we might see signs in the body that are not motor. So for example, we might see unexplained changes in breathing or apneas in babies, or we might even see differences in their behavior or changes in the behavior where they're freezing and staring. Next slide, please. So here we have an example of a video that we're going to show you of a baby in the ICU who had a seizure. And in this baby, you'll see that this baby is going to have movements that involve the baby's arm and leg. And you're going to see kind of rhythmic movements that involve the shoulder and also rhythmic movements that involve the leg. And one of the important things to remember when a baby has seizures and they involve motor movements, so when there are these rhythmic movements, is that they're not suppressible, meaning that you can't stop them. So in this video, we're seeing that the baby is having some movements in his hand. And in the video, you'll also see that he's kind of staring and not quite paying attention to his mom. And when you notice that this is happening, the mom in the video actually puts her hand on the baby's hand to see if the movements can be suppressed. So to see if the movements can be stopped. And this is an important thing to do because we know that seizures cannot be stopped. So if you're noticing these repetitive jerking movements or shaking movements, then you would put your hand just on the baby's hand or on the baby's arm to see if you're able to stop those movements. So these are examples of seizures with clinical signs. But in babies, we can also have seizures without clinical signs. So we call these electrographic only seizures. And these are seizures that we usually see after we've treated the seizures, typically with anti-seizure medications. And because these seizures don't have clear clinical signs, this is why doing a test called an EEG is very helpful for us in the ICU to look for these seizures. So next slide, please. So here we have an example of what an EEG looks like. So on the left side of the slide, you'll see a baby in the ICU with some stickies on his head and a bunch of wires. And these wires go to our EEG machine. And under the stickers, we have electrodes, and we've put these electrodes on the scalp to monitor the electrical activity in the brain. And on the right side of this slide, we have an example of what our EEG screen looks like. And the squiggly lines represent the electrical activity in the brain that we're picking up from these electrodes. And an EEG is a very helpful test for us to use in babies where we suspect that they might have a seizure or we're not sure whether they're having seizures. So EEG in babies can be used to confirm whether suspicious events are seizures. And it can also be used to look for subtle seizures, or what we call electrographic only seizures, where we're not seeing any obvious clinical signs. Next slide, please. Some other investigations that a baby with seizures might undergo are a head ultrasound and brain MRI. And this is important for us to look for what the cause of the seizures are. So these tests might be helpful in detecting brain injury, They might also be helpful in detecting changes in the folding or in the structure of the brain, so what we call brain malformations. They might also be helpful in looking for signs of infection or meningitis. These babies might undergo undergo blood work to look for changes in glucose, so if there's low glucose or abnormalities in electrolytes like sodium, for example, or if there's an infection in the blood that might have caused a seizure. Next slide, please. So when we talk about treatment of seizures in babies, we talk about a few different things. The first thing we do is we treat the provoking factor. So for example, if we're seeing a seizure in a newborn because their blood glucose is low, we would treat the low blood glucose by giving more glucose. Next slide, please. Our next step might be to give anti-seizure medications to stop the seizures in that acute period. And so some of the common medications that we use in babies are phenobarbital, phenytoin, or a medication called Keppra. But we need more research to understand what anti-seizure medications are best for treating seizures in preterm babies, because many of the studies that have looked at seizures and anti-seizure medications in babies have been in term infants. So this is an area of ongoing research and an area in which we need more information. Next slide, please. Finally, a minority of children will go on to develop epilepsy, and these children may need anti-seizure medications for a longer period of time. However, in the vast majority of babies who we see with seizures, they might need seizures for a brief period, days to weeks to months maybe, and then we're able to safely stop the anti-seizure medication. Next slide, please. So I think it's important for us to think about why we treat seizures. And this is really because we want to focus on promoting brain development and neurodevelopmental outcomes in preterm babies. So on the left hand of the slide, we have two MRIs, and these MRIs were done in the same preterm baby. The first MRI was done when this baby was 30 weeks gestation, and the second MRI was done when this baby was around term, so at 39 weeks gestation. When we look at these MRIs, we're looking at the size of the brain, and you can see how the brain has grown between 30 weeks and 39 weeks. But we're also looking at the structure of the brain and the folding of the brain. So if we look at the brain at 30 weeks, it looks quite smooth, and we don't see a lot of the lumps and bumps that we would see, as we see closer to term at 39 weeks, where the brain is very lumpy and bumpy. So during this period of brain development, there are a lot of changes happening in the brain. And when a baby has repetitive seizures, it can impact brain development and later neurodevelopmental outcomes. And this is why it's so important for us to monitor seizures and treat them during this period. Next slide, please. Finally, I'd like to end off by talking a little bit about what to do if your child has a seizure. So what to do really depends on the type of seizure that your child has. And so if your child has seizures, please make sure to ask your neurologist for specific guidance around what to do. But here we have a short video from About Kids Health.
First, stay calm so that you can provide a... It's important for all caregivers to know how to manage a seizure. First, stay calm so that you can provide effective help. Then focus on preventing injury that may result from the seizure. Stay close to the child but don't hold them down. Move any objects that are sharp or hard, and if your child will let you, roll them onto their side so fluids drain out of their mouth. Now make them as comfortable as possible. Take off glasses or anything that is hard. Take off any tight clothing, especially around the neck. Then put something soft, like a folded jacket or sweater, under their head. Keep bystanders away from the child. Watch to see how long the seizure lasts, and note how your child looks and moves so you can give the doctor an accurate report later. For example, how were the child's eyes moving? Were they turned in one direction or looking straight ahead? Which part of the body was shaking? Were the movements symmetric? Don't give the child water, food, or medication until the seizure is over and the child is fully alert. They may be drowsy or confused for a while after the seizure. Stay calm, low-key, and be reassuring.
All children who have had a seizure should be assessed by a doctor. If you're alone with a child, call an ambulance. You don't want to risk having the seizure recur while you're driving and the child is alone in the back seat.
All right, so I'm not sure how well the video played for you, but just to kind of go through briefly what the video outlined was that if your child has a seizure, it's important to do a few things. So the first thing is you want to put your child down on the ground on a flat surface. You want to put them down on their side so that if there's any drooling or any secretions, they kind of come out of the mouth and don't kind of block the airway. And then you want to time the seizure and make note of what happens during the seizure while you're waiting for the ambulance to come. It's really important, especially if you're alone, to call 911 and have EMS come rather than put your baby or child in the car and drive them, as you know, they might be on the back seat and you wouldn't be able to see them as you're driving. We'll make sure we leave a link to the video so that you're able to view the video in more detail. Next slide, please. So I'd like to just end off by saying that seizures in newborns can be very subtle, and that it's important for us to remember that newborns typically have acute provoked seizures. So this means that the seizures that we usually see in newborns are caused by an acute illness or by brain injury. So it's important for us to look for that. It's also important for us to remember that most newborns with seizures will not go on to have epilepsy and won't need to be on anti-seizure medication for long periods of time. Next slide, please. So we'll leave links, these links for you below. The first link is a link to the video, and then there's a lot of really great information about seizures and epilepsy on the aboutkidshealth.ca website, as well as Epilepsy Canada. And thank you so much for listening, and I'm happy to take any questions that you have.
Thank you so much for your presentation. It was great, a lot of good information. I'm just sharing the links on the comments. So if people want to just click, it's a live link for the About Kids Health, the SickKids website. Thank you so much. So my first question to you is, so based on all that you said about the injury or infection, so are babies who are born preterm in the ICU at a higher risk of having seizures?
I'm so sorry, Fabiana, but it looks like there might be some technical issues and I wasn't able to hear your question.
Okay, the question was about being in the ICU born preterm. Are those babies at a higher risk of having seizures while they are still in the NICU? Can you hear me, Dr. Selvanathan?
I'm sorry, I don't hear you, Fabiana, and I don't see you. So I think there might be just an issue with the streaming here.
Okay, do you want, okay, so if you cannot hear me, I'm going to put in the chat. Yeah, I think we're having some difficulties here. Yes, so I just asked her to log off and log in back again so she can answer all the questions that you have. Yeah, this is what happens when you go live. Things happen, technology collapse sometimes. So just wait for Dr. Selvanathan to join us here again. And thank you so much, Anna, for joining us here today. It is certainly very helpful for an ICU nurses. Are you back now? Can you hear me?
Yes, I'm back now and I can see you and hear you. Not sure what happened there. So sorry about that.
Oh, that's okay. It happens after almost 200 live sessions. Everything never happened here, so we're used to it. So totally fine. We have a comment here from Emma. She said, this is really important work and your presentation was really meaningful as an NICU nurse. And we also have Dr. I'm probably pronounced wrong, Inayata from Pakistan joining us live today. So this is great to have healthcare providers coming to your presentation. So I actually had asked you if babies born preterm who are still in the ICU are at higher risk of having seizures.
So babies who are born very preterm are at higher risk of having seizures. And the most common cause of having seizures in babies who are born very preterm is intraventricular hemorrhage. So this is something that we do monitor for in the NICU. And you'll notice sometimes that if there are suspicious events, then the NICU team might consider doing an EEG, where they're placing the electrodes to look and confirm whether the events are seizures.
Okay, so let me just see. We have another comment here. Thank you so much. It was a nice presentation. Next question is, if the baby didn't have seizures in the ICU, can they develop seizures later after discharge?
So sometimes we do see that babies will develop seizures later. However, this is usually in the context of there having been, quite significant brain injury, or if there's a change in the folding in the structure of the brain. Typically, you would know that when your baby is in the NICU, and often, most commonly, we will see that babies have seizures in that acute period while they're in the NICU, and it's much less common for them to develop seizures when they're older.
Okay, so for the babies who had seizures in the ICU and now this family is preparing to going home, which is a very scary time for any parent to live in the ICU, how parents should be prepared to understand how seizures look like, what they can do? Is there a combination of education from the healthcare professionals to the parents while in the NICU, and how to be proactive?
Yeah, that's a great question. So typically, if your baby had seizures in the NICU, you've probably met one of the neurologists who worked there, or potentially one of the neurologists at SickKids. So one of the things that we will discuss is what to do or what to look for when your baby goes home in terms of seizures. So one of the signs that I usually tell families is, if you're not sure what the movement is, one thing you can do is, seizures shouldn't be something that we can cause or start or stop. So if you're seeing some shaking movements or jittery movements, you can try placing your hand on the baby's arm or leg to see if you can suppress or stop the movement. If you can stop the movement, then that's probably not a seizure. If you're not sure of what the movements are that your baby is doing, one of the most helpful things to do is to take a video. And this is what I tell my patients: take a video and you can email them, and I'm happy to review them. And this is what most of us neurologists will do, because the videos are very helpful for us to review. And then in terms of being prepared, so I would suggest, if you have questions, take a look at that About Kids Health video on what to do if your child has a seizure. Also talk to your neurologist about specific guidelines for when to call 911 and when to potentially give a rescue medication at home, because this might differ based on the type of seizure that your baby has. But if you have any questions, I think About Kids Health is a great resource. And this is something that when you go home from the NICU, we make a point to also have a discussion about how to monitor for seizures and what to do and who to call if your baby has a seizure.
That is great information. You mentioned there's nothing that can cause the seizures, but are there any triggers that parents could try to avoid?
Yeah. So common triggers for seizures are when a baby has an infection. So specifically when they have a fever, you might notice that there's an increased risk for having seizures. Another trigger might be sleep deprivation. So when babies are very tired or kids are very tired, we might see that there's an increased risk for seizures during that time. And then a common trigger that we see in kids who have epilepsy is when they've missed their medication. So when there are missed doses for whatever reasons, then there's also an increased risk for the baby having or the child having seizures. So those are some common triggers to think about in kids who have seizures.
Okay, that is great. So the next question is, can seizures cause brain damage in babies?
So that's a great question. So with brief seizures that we see, which is what we typically see most commonly in babies, brief seizures, they don't happen very often. We don't think that these cause any kind of brain injury or brain damage in seizures. However, in children who have repetitive seizures, what we really want is to promote their development, promote their brain development, and promote their neurodevelopment. And this is why treating seizures is important. And it's why we give anti-seizure medications to reduce the frequency and ultimately to try to prevent any future seizures, because we want there to be healthy brain development and the kids to really thrive and do well in school.
Absolutely. And long-term effects of seizures, because we talk about this neonatal period, like the first few years at home. So the long-term impact, if you have seizures in the NICU and maybe they disappear in the first year, is there any long-term consequence of that?
So there isn't a lot of research that's looked at long-term impact of seizures in preterm babies and their neurodevelopmental outcomes. So this is an area of research that needs further study. We know that children who have epilepsy are at higher risk for having some difficulties with their learning at school. And so it's often a group of children where we would pay more attention to how they're doing in school. We might refer them to see one of our neuropsychologists so that they can help put in a good plan for their learning and their development at school.
Okay, my next question is, should all babies who had seizures in ICU be followed by a neurologist? Because a lot of families get discharged from neurology from the first few months at home if there is not a big issue happening or something to be followed up.
So I don't think that every baby who has seizures in the NICU needs to see a neurologist long term. I think what's very important, though, is that every baby who's born very preterm and has been in the NICU has someone who's following their development and has a really good primary care provider, whether that's a great pediatrician or a great family doctor, so that you have someone to go to if there are any concerns. And, even if you're discharged from your neurologist, we're always happy to see again if there are any concerns that develop over time.
Absolutely. Okay, Dr. Selvanathan, thank you so much for joining us here today. Always a pleasure talking to you, learning from you. You have this amazing ability to break down very complicated issues and translate into lay language so we can all understand as parents. So very grateful to have you here once again.
Thank you so much for inviting me. It's been a wonderful afternoon with you, and I'm always really happy to join.
Thank you so much. And to all of you watching us live today, thank you so much for joining us here today. And the video of today's session and all the videos from our live series are available on the CPBF website, which is right here, the Canadian Preemies.org. And I want to thank our sponsor, AstraZeneca, for their ongoing support of our education sessions. And we are a charitable organization, and we believe that through support and education, we can empower families, ensuring they're ready to care for their babies. Please visit our website and consider making a donation. Together, we can create a brighter future for all our families. And I see you again next Friday, 1 p.m. Eastern Time. Stay well.